Yes, thank you very much. I hope, first of all, that everybody can hear, and importantly as well, that everybody can see. I'm certainly conscious in the main room that I'm struggling to see the screen. So if there's anything that people can't see, then just shout out in the middle of as I'm speaking and ask me what it says, and I'll explain to you. I've tried to use some quite big font, so hopefully that will be quite useful. My responsibility within NHS Lothian is looking after principally the communication side of things, which is what I was employed to do: internal, external communications, media relations, that kind of thing. And social media kind of came under that to start with. Within the last 5 or 6 months, I've also taken on responsibility for what we're calling public affairs, which is in effect public involvement. It's freedom of information, it's parliamentary liaison, and it's also what's called complaints. Now, I've got an issue with calling it complaints in the first place because I don't believe that it should just be complaints. It should also be compliments and comments, but nevertheless it is a complaints team, and I've had that for the last few months. So what I want to talk about today is just about how NHS Lothian in particular is using social media in terms of engaging with the public and indeed patients. Some of the pitfalls that we've come up against in doing that, some of the benefits of it, and the fact that I feel that we're really just at the start of the journey in terms of using social media, and I think that most organisations, if they're honest with themselves, will admit the same. Hi, grab a seat. So, isn't this the image we all have of the NHS? Obviously, everybody loves the NHS. We do put a lot of effort into creating the brand, those of us here who are in the communication side of things. Certainly within my own team, and I know coming down from government, there's a lot of emphasis put on the safe, person-centred, quality key messages that we should be putting out in all of our communications and our press releases and the things that we're doing. And we like the media to cover our reports and use nice pictures like this and say that we're all doing really, really good things. And there's an example as well. The tremendous tribute paid to the NHS at the Olympics last year had many people grabbing a hanky and wiping away a nostalgic tear for the NHS as we like to think it's perceived. The tabloid media in particular still like to project an image of the NHS and its nurses as something from the 1950s. When Matron was in charge. How often do I read in comment sections, "Bring back Matron," when Matron was in charge, and all nurses were gentle angels of mercy. The Olympic ceremony again captured that well. You remember down the bottom all the kind of dancing nurses in the beds, and the interesting thing about Twitter at that time was everybody was saying, "Where's the NHS getting all these beds? Can we have some of them for our board, please?" So the reality, of course, can be something different. Robert Francis, just last week, his report into the crisis at Mid-Staffordshire has been like an atomic bomb dropped in the heart of the NHS. And despite being specifically about care at one hospital, the ramifications of the Francis report are really for the NHS across the whole of the UK. And our friends in the media, of course, have responded in style to the Francis report. You just can't beat a good scandal, can you? News editors up and down the country are probably a bit angry at the moment that it's come at the same time as Jeff Hoon's case and the horse meat and beef stories which have split the news agenda and lit up the social media world into the bargain. I do promise there will be no Twitter-related horse meat jokes from me today. I'm going to concentrate on the main reason that we're here. Sorry, I couldn't help myself. Sorry, somebody's just bringing me in a lectern here. Thank you very much. That's just to feed my Tony Blair complex. You see, I need to have a kind of lectern in front of me before I do anything, so you can kind of hold on to it. That's great. Thank you very much. Social media, of course, had a field day around Francis, and a field day, that was another horse meat joke in case you missed it. And Hune, but Francis really captured imagination, and Twitter and Facebook indeed were set alight by things that were happening. And for anybody employed in the NHS, Francis is certainly made for some grim reading. Very quickly, some influential tweeters were pointing out that this wasn't just about Mid-Staffordshire, and actually this was about the NHS as a whole. You can see Andrew Neil up there straight away talking about 4 other NHS trusts had worse death rates than Mid-Staffs, and saying that was incredible, obviously. Sean Linton, I don't know if many of you follow Sean. Sean's somebody who at the weekend took home the entire Francis report and tweeted lines from it over the course of the entire weekend, which obviously he's got a lot more time in his hands than I do. But it was interesting to read nevertheless about how that was being portrayed. Anybody who was at I did a shortened version of this back last year, and one of the chaps who was sitting at the table with me was a guy called Tim Wright. Now, even Tim Wright took to Twitter to say that is anyone surprised by this report, because his personal and family experience of the NHS from GP to hospital is dreadful, so actually it wasn't a shock to him. So that's in terms of the kind of reputational damage that's been impacted on the NHS as a result of this report, and the way people are using social media to feed back about that. You'll see my upset comment underneath it, where I say that I'm now crossing him off my Christmas card list. But what Francis has shown, however, is that social media is now the tool of choice for many people to express their views about what's happening in the world. People are moving away from putting pen to paper to express outrage via the media with the traditional letter to the editor. And rather than the on-off discussion, conversations about your organisations are taking place all the time, 24 hours a day. So for a public sector body like the NHS, we have to be in the middle of this, to see what's being said about us and to take part in the virtual debates that are happening every second. And I truly believe that the public sector cannot switch off to the opportunities and threats that this poses. Some people have touched on this already, but I just want to talk about the NHS in general and its use of social media. I was interested to see the slide Gary put up this morning about the amount of boards who are using it now. That has gone up drastically since I last did this input and criticised some of the NHS boards, territorial boards in Scotland, for not using social media. As it stands, still not everybody is using it. NHS Lothian was, I'm pleased to say, one of the first, but some just don't use it in any shape or form, or only for proactive campaigns, not as an organisation. For people who are using it, it's different approaches and styles, and as I say there, some are good and some are not so good. And for many of the NHS boards, the use of social media is very proactive. It's really just being used as an extension of their website to put out press releases and other information. Kind of the way some celebrities use it, you know, where they've got 10 million followers and they put out something positive about themselves, but when loads of people reply, it's just ignored. There's no response to that, so it's not truly engagement as such. It's just a broadcast tool, and too many of the NHS boards in Scotland still use it in that way, and I understand the reasons behind that, which we'll go into in a minute. The mainstay in terms of social media is, of course, Facebook and Twitter, and others, if we're being honest, are seldom explored. There is some use of YouTube. We saw mention of Pinterest this morning, for example, but really the big two are Facebook and Twitter, and not a lot of people are venturing much further than that in terms of use of social media. And it is, you know, the rise in social media is coming as a result of the demise of traditional media. I was warned before I come in today that there might be journalists present. Anybody willing to admit to being a journalist today? I was a journalist, so I don't mind having a go at the media. The traditional media is going down, and you only have to look at the figures to see that. Papers like the Herald, for example, no longer publish figures as a national paper. They've moved to a regional paper so that they don't have to put their figures against the others, because it's starting to impact on advertising revenue. I did this the last time as well, but straw poll, who here today bought a newspaper before they come in today? An actual newspaper that they read? 3 people. I bet if I'd asked that question 5, 10, 15 years ago, almost everybody would have put their hand up. Who here read a newspaper that they didn't buy, something like Metro or another paper that they picked up somewhere? It is interesting, isn't it? Who here went onto like the Daily Record's online website or the Herald's online website and read that as they would a newspaper, i.e. they went onto the website and read the newspaper? John, you've also got an awful lot of time in your hands. And who uses social media to get interesting links to specific articles on newspapers? Well, that actually stands for itself. Obviously you can't see yourselves, but most people put up their hands there. That's certainly the way I interact with the media nowadays. As a director of communications, I don't read a newspaper. I don't buy newspapers. I don't read papers on my way to work, mostly because I'm doing a motorbike and it's very difficult. But I don't buy newspapers. We don't get papers delivered to the office anymore. We do all of our newspaper through electronic media monitoring, or indeed through articles that are sent to us via social media that people will think have a specific interest to us. And more, that's the way that people are engaging with traditional media. They're seeing things that are of interest to them. They're not flicking through the pages of a paper and stopping at something that's of interest. They're now, through Twitter, joining communities where people are sending links to stories that they know will have an interest in reading it that way. And it's another debate for another time, but it is interesting to think how the media is going to turn out in the next 5 to 10 years and the impact social media is going to have on that. And there are a number of challenges around social media. It's not all a big happy family as yet. In NHS Lothian, and I'm sad to say I said this last year as well, and in most public sector organisations, staff still have no access to social media from their desktop PCs. My own team use their own phones. We managed to get a standalone system fitted recently that allows us to go to a standalone PC and access Facebook and Twitter and allow the staff to use it that way, but we don't have it in our desktop PCs. And that to me is a shame. I was interested to hear one of the boards today saying that they managed to get that lifted, and I'll be finding out how they managed to achieve that, because we just cannot convince our IT security people that it is in our interest to have access to this. And from what I said earlier about your brand being discussed 24 hours a day, I again repeat, it's absolutely essential, specifically for communications people, to be able to have access to social media, to see what is being said about your organisation and to respond to it and to react to it. It's just, there can't be any other way. I always tell people the story, and Emma will remember this because she was there at the time, at Strathclyde Police. When I started at Strathclyde Police with one internet computer in the whole of the force. It was in a room that was locked. It was in the communications team. If you wanted to go onto the internet, you had to come into that room, you had to write down what sites you were going to look at, why you were looking at those sites, how long you were on each site, and a book, and personally sign it at the end. That book was audited at the end of every month to see who'd been looking at the internet, and it was the old dial-up system, you know, where you look at the site and go and make a cup of tea and come back, and it's all loading up picture by picture. And I can remember saying to the head of IT security at the time that it's only going to be a matter of years before everybody has access to the internet on their own desktop PC, and his response was just a hearty laugh and over my dead body and all that kind of stuff, because people will use it to hack into your secrets and you know, prisoner information and all that kind of stuff. And of course the reality is that now people do have internet access on their desktop PCs. You couldn't possibly imagine life without it, actually. And the same kind of arguments were used then. You know, you need it to see what's being said about you, you need it to be part of the online community. For me, social media is going exactly the same way. And I would be astonished if I was here, you know, next year or in 5 years' time saying that people didn't have desktop access in the public sector to social media for reasons to do with security. I think it's just an absolute essential again. Social media, of course, by its very nature, is 24/7. It doesn't run to deadlines. It doesn't have a period of shutdown. And that gives us questions about how you can monitor it 24/7 and how you can stop or moderate things that are being said. Resourcing is interesting. Does everybody here represent an organisation that uses social media? Where does it sit within your organisation? Some people just want to shout out.
IT.
IT? Comms. Does anybody have it within the kind of the feedback type teams, complaints type teams, or customer services, anything like that? So it's communications or IT. And that is one of the issues. Nobody kind of knows where it really sits comfortably. For me, the department that I've got is kind of the nearest to the perfect place for it to sit, which is a bit of communications and a bit of customer relations. So the two departments being part of the one, I think it sits very well there. For me, it doesn't sit within IT for some of the reasons that I've outlined. You can get a lot of technical experts, but they're not exactly the editorial experts sometimes in some of the things that are being said. So resourcing is a big issue, and whether that's going to be 24/7, we currently have people who operate on a social media rota basis. So it's their responsibility during the week, the same as it would be if they were on call, to monitor Twitter, to monitor Facebook, to see what things are being said and to respond to them, and for me to empower them to do that within the kind of the boundaries that we have within the NHS to do so. So resourcing is a big issue. It's not something you can just put in place 9 to 5, in my opinion, because then you're leaving it. Your reputation can be destroyed in a matter of seconds, and if that comes in at 5:10 at night and you've switched off from looking at it, then that is going to give you some big issues. Moderation is another one I know that I don't hold all the answers to. There's a very thin line between criticism and abuse, particularly within the NHS, where people have very strong opinions about things that are happening, and I showed some examples there. If you under-moderate, the organisation can be exposed and people can say things about you, and things can happen on there and be said that can be very uncomfortable when you look back over them. But if you over-moderate, then nobody will use it. And what I find interesting is if you look at some of the newspaper sites, for example, the Scotsman still allows you to go on pretty much and comment on a news story, and that goes up real time, and if somebody complains about it, it might be moderated thereafter. The Herald introduced something that was that they moderate every single comment and only put it up after somebody's seen it. And it's taken away the kind of immediate reaction stuff that you can get, the immediate conversation. But by the same token, it's removed a lot of the nonsense that you get when you read the Scotsman comments. And I don't know if any of you ever do that. I do it sometimes if I'm feeling too happy or too optimistic. I like to read the comments in the Scotsman that bring me back down to earth again to let you know what people really think. Departmental structures, as I've said, you need to have something in place that says where this sits, and for those of you who have it within the IT department, my strong advice would be to say that it needs to be moved into communications, or at the very least into your customer relations side of things. Confidentiality is a major issue with social media. Within the NHS, we consistently get people sending us personal details about something that's happening to them. Now, and for those of you in the NHS, you will know that you cannot discuss patient information without the written consent of the patient. So if somebody comes on and says something like, you know, I'm due in for an operation on such and such, what should I do in advance of it? There's general things that you can do in response, but you cannot talk about that person's specific case in the same way in which we don't do to the media. And they would have a challenge to you if you started doing that. So I think we need to be careful about how we use social media in terms of patient confidentiality. And again, I think that's something that will develop as time moves on. And you'll hear everybody saying it today, we can't ignore it. Hundreds of people, or millions of people are using social media all day, every day, and we can't bury our heads and dismiss this as a fad or irrelevant. Reputations, as I've said, destroyed in one fell swoop if you're not on top of this. So what are the benefits of social media then? I know hopefully I'm preaching to the converted here, which is why you're here in the first place. But it is at the very edge of modern technology. It does keep up to pace with the various mobile devices that are out there, tablets, etc. And it's short, sharp and to the point. The way I like my communications, 140 characters and nothing more. It's absolutely a two-way process and a very effective way of not just getting a message across, but engaging with people on a very, very personal basis. All research now shows that social media is being used across the generations. We saw that very interesting slide. I think people have this perception that it's only children and teenagers that are using social media. My personal experience and the facts now speak for themselves. Actually, the spread of people using social media is very, very far and wide. It can be used proactively and reactively. You can push out campaigns, you can push out information, you can talk about the press releases, you can talk about the launches, and that's how some people do use it. But also, and what we're here to talk about today is the reactive side, the feedback through social media. NHS Lothian recently launched a consultation into the future of homeopathy, which is always a contentious issue. And we pushed it out through social media to say this consultation was taking place. If you're interested in coming to it, then here's a link to the website. We had information that we downloaded as well that people could download as PDFs, etc. It's been the biggest thing that anybody's ever looked at within NHS Lothian. For what is actually a fraction, and it's a tiny fraction of our overall budget, the interest that's out there from two opposing groups has been immense. On one hand, you've got the people who are big fans of homeopathy and who think this is the greatest thing and who have patient stories and who will stand by it and say this is the greatest thing, and the NHS absolutely, if it has patients at the heart, has to be using it. And on the other side, you've got the sceptics, many of them doctors, I have to say, who say this is an absolute waste of money, it's a waste of time, it shouldn't be getting used, and the NHS should not be spending taxpayers' money on something that doesn't work and has no basis in science. So there's been a very interesting debate on social media around homeopathy, and it's been an excellent way for us to gauge public opinion. And the results of that are about to be published this week, actually, and there's a meeting next week to discuss it. I know what those results are, but my lips are sealed because you're all probably tweeting at the moment. By putting links onto your social media, you can drive people to get more information from your website. We in NHS Lothian used this very effectively during the Legionella outbreak that we had last year, where there were lots of people looking for information about what was Legionnaire's disease, how do you catch it, is it contagious, can you get it through the drinking water? Thanks to the Daily Record, whose front page headline was "Killer Bug in City's Water Supply." Fail, as they say. So yeah, you can use that to put out information and drive people to your website by providing a link. And we did that both to our own website and to NHS 24's website. And obviously, social media isn't the be-all and end-all. It's another tool in the box, and it must be used as such. And something that we always get constantly in terms of our feedback is that there's still a large proportion of elderly people who make up a large proportion of our patients who don't have internet access, or certainly personal home internet access, and who aren't inclined to go to the local library and look up this kind of thing on the internet. They're just not, they're not tuned that way. My mother's in her 70s now. She's got a laptop, but she's lucky if she uses it, twice a year kind of thing. She checks her emails and she finds she's got 5,000, and she phones me to ask about what all these special offers are she's been given and all this kind of stuff. So we have to remember that. So in terms of the benefits of social media for feedback, the main goal of customer service is obviously to help someone resolve their issues. And while phone conversations can help solve the problems, the waiting times on phones do not. So Twitter, for example, is a lightning fast platform that can help sift through and solve problems quickly, and we certainly try to use it that way if we can. If it's a small issue, then a single tweet may be enough, and for a more complex problem, then we can initiate a deeper conversation and get people to get in touch with you more generally to have a chat through what their issues may be. It does promote a positive brand image, I feel. It's great customer service gets talked about. I'll show a few examples later, but my experience is that if people have a positive thing to say about the NHS, they're more inclined to say it using social media than to write you a letter or to send something in, which has been the kind of traditional way of doing it. One happy customer, it says, can be turned into an international story. I'm sure we've all seen examples where people go onto Facebook and say something that's been really positive, and all of a sudden, within a matter of months, it can have hundreds of thousands of hits and likes and all the rest of it. Staff involvement, I feel, is an underlooked one in terms of social media. I think that if your own team doesn't buy into the notion of helping the customer, then they're going to provide a subpar assistance. And Twitter is not only a more interesting platform than phone or email, but it does give staff a better picture of their impact on others. And I think that particularly in customer relations, that we should be opening that up. Social media should be opened up to customer relations teams to see the kind of things that are coming in, to see how quickly they can respond, in the same way in which they can sometimes deal with a complaint on the phone. There's no reason why we can't do the same using social media. And we heard that obviously this morning as well, cost reduction, customer service, it takes less time, it doesn't cost very much money, and you don't have to put a huge investment into it. But it is a tough shift, and people, can you all read that there? It says, first of all, you should know that I'm typing this with my middle finger. Dear customer service. People are arguably more open, opinionated and willing to tackle big organisations now than at any other time before. That's just an absolute fact. People would never have challenged government in such levels and public sector organisations at such a level as they do now. And what social media has done is it's given the small man a voice that can have an impact. So let's have a look at some of the stuff that we've had within Lothian in terms of complaints, and hopefully again you can read that. It's a chap that says, I've been trying to call your operator, no response from your voice system or operator for over 3 minutes on 3 occasions, help. And we've put sorry about that. If you let us know what department you want to speak to, we'll get you a direct dial number. So again, a response immediately to an individual. I've been let down by NHS Lothian. My daughter's appointment was supposed to be August, but it's been changed to September and now November. This is a postcode lottery, and they've copied in Nicola Sturgeon, who at the time was the Cabinet Secretary for Health. And again, we've responded to everybody saying, please send us details to the complaints team. People will complain instantly and on many occasions without thinking. I always liken it to the kind of drunken text that started when mobile phones first came out, and you send that text at 2 in the morning and then think, well, I hope I never sent. The secret for me is to respond on a personal basis too. So when somebody comes on with what is obviously a complaint that's personal to them, if we respond to that on a personal basis rather than a kind of generic corporate response, then it has a bigger impact. Some complaints, of course, can be dealt with immediately, like these ones, but we have to figure out how that works with our complaints process, because our complaints process says that there's a 3-day acknowledgement and there's a 20-day response. But what we're doing with social media is we're responding to people immediately, and perhaps that's disadvantaging people who are coming through the more traditional methods. but then the quandary is that we can't then say, if you email in, we'll respond to you immediately the same way we do social media. So is that driving people to social media, or is it disadvantaging other people? I don't actually know the answer to that, and it's still quite early days with the way this is being used, but I do think it's an interesting conversation to be had. My own feeling is if it's easy to answer, then we must answer it the same way in which if somebody phoned up and you could give them the response, why wouldn't you do the same on social media? Failing that, we have to stick them through the traditional process, and it's only right that we do so. Just some other complaints there. Today I received a letter from NHS Lothian with the date of my forthcoming admission, the date of admission today. So angry. And we've put, we'll look into this as a matter of urgency through our complaints team. Somebody else, I had my knees x-rayed 2 weeks ago. They said it would take 1 week for the results to come through. I phoned today and nothing. Again, that's interesting because that's somebody who's already phoned to make a complaint. They feel it's not been dealt with properly, so they've then used social media to make a very public complaint, and their feeling would be that we have to respond to that, and they're right, we did respond to it. Instant off the top of the head complaints that people will have. I'm not impressed to see somebody park a 4x4 in a disability space, smoking in our scrubs, then going back to hospital, and we're not impressed by that either. Can you email details of when and where that happened? One that I find very interesting, I'm sitting in a practice waiting to be seen 47 minutes past my appointment time. That's pretty good. Try explaining that to my boss, complaint, and we've put sorry, send us some details if you want, but it does show you that there's somebody who's waiting for an appointment, they're 47 minutes late, and they're obviously sitting there with phone in hand, and they're immediately tweeting that as a complaint. In the past, that type of person would have had time to go home, think about it. Am I going to send in a letter? Am I going to phone somebody? Probably not. So actually it has increased the traffic in terms of complaints as well.
Why did you not tweet back? Because you're going to have somebody at the reception when you're going to be seen.
Just another quick example there. It seems to always be the drivers of our vans at the moment, with the full registration plate there as well, of course. I should probably have redacted that actually, but not to worry. While driving and turning right, it's a good job sick kids is so close in case he runs one over. And we've put, again, contact us with details through the complaint. So you see, we will try and drive people to the complaints side. Everybody know Dr. James Logan? Embarrassing bodies. He's actually a doctor in zoology, but don't let that get in the way of a good story. Dr. Logan was sitting in the Royal Infirmary of Edinburgh in between Christmas and New Year, and in the space of a few minutes he fired off a number of tweets to his vast amount of followers about the unhappiness he had with the care of his grandmother. Let's leave aside the fact that he shouldn't have been using his phone at his grand's bedside for a minute and look at the impact that this kind of thing had. So there he goes. First one. I'm genuinely disgusted by the attitude and the way the family are spoken to and treated by nurses and doctors in the stroke unit at the Royal Infirmary. And then within a couple of minutes again, extremely rude staff, certainly not comforting to family. They make you feel like you're a massive interruption to their day, stroke unit. And on he went. Staff, Donna and sister have been great. The rest, including nurses, junior doctors and consultants, should be ashamed of the level of service. And then I get that they're busy and understaffed, but I'm genuinely shocked at the lack of communication between staff. And again, name-checking the stroke unit. And just for good measure, and if I hear one more time that it's Christmas as an excuse for poor service, etc., etc. Now, I don't have them up here, but what was happening was that in response to every one of those tweets, his followers were coming back on, name-checking NHS Lothian and saying this is an absolute outrage, the NHS is terrible these days, it's shocking, I've had the same experience with my grandmother, they're really poor at looking after elderly people. That report that came out recently showed that they don't even feed them properly, so it was just building up a head of steam. I wasn't on call at that time, but I did notice it was coming through, and over my Christmas turkey, which I was choking on at that point, decided that I would respond. So I responded personally, albeit using the NHS Lothian account, which was, I'm genuinely sorry to hear that. Every patient is important to us. Please email your details to the complaints team. Immediately he came back and put, thank you for the contact info. I'll definitely write to explain the extent of the situation. And just to gild the lily a bit further, I put, please do. Feedback is vital to ensuring patients' needs are the top priority. Sorry if that's not been the case here. I only did that because I knew I was going to be speaking at this conference and I thought it'd be a good example. No, that's not true. But the interesting thing about that is that it seemed to calm him down and he stopped tweeting immediately as he got the response. And we asked him to formally submit a complaint about his experience To date, he's never put a complaint in, so he has never formally complained about it. It was just letting off steam, sitting there, not happy about what he was seeing taking place. And the feedback we got from nurses was he was taking pictures with his phone of dust on the side of the ward area and all the rest of it. And it's something that really could have built up. And if we'd ignored them, my feeling is it would have got worse and worse. And actually, those of you who read the papers, funnily enough, over that time would remember that it got quite extensive media coverage. That this celebrity doctor of embarrassing bodies was criticising the care of his grandmother, which, you know, the ordinary person in the street wouldn't have had the media coverage for it. But actually, I have to be honest, when I was responding to him, I didn't know who he was until I went onto his obviously profile page and saw who he was, and then Googled him and did all the things you do nowadays when things like that happen. But it is interesting that he's still to formally submit a complaint, so he obviously felt that just having somebody come back and recognise that he had an issue from the official body itself was important. I do have to say though, it's not all bad. And we find that certainly in terms of compliments, in terms of official recorded compliments, we get more through Twitter and Facebook than from letters to the chief executive or chairman or anything like that. We get loads of stuff comes through. You know, hospital appointment this morning, caring doctor, efficient photographer, even get a goodie bag, feeling better already, praise. And again, we feel it's important to respond to it rather than just let it be said. We thank them for the praise. You know, fantastic service as always. And you'll see we've also taken the opportunity in the second one there to push our own staff awards scheme, quite shamelessly, but put the hashtag out there that if somebody's got something they want to praise us and somebody looks at that, then potentially it actually drives people to your staff awards scheme. Which worked, because then somebody put everyone who works at the sick kids, all the midwives in the birthing centres, I think they're all amazing, and then used our hashtag for the staff awards scheme. So it was starting to drive that. Somebody else, I want to start with a massive thanks to NHS Lothian and NHS Direct for sorting my 6-year-old's eye so brilliantly and quickly. I love the NHS. These are the ones we like receiving, obviously. And you'll see, obviously, that we've responded again in kind. I've never had better treatment in any hospital. Absolutely dedicated to providing excellence in healthcare. Big thanks. We were lucky enough to be cared for by the excellent staff at Simpson's maternity wing this week, everyone a star. And again, we're responding, glad to hear it. Thanks for the feedback, much appreciated. What we're trying to do just now is collate the positive things that we receive through Twitter and Facebook and put them in our internal communication to staff and make staff and their managers aware that this kind of feedback is coming in so that they can see that it's coming in and that it's being recognised. I think that people nowadays are less inclined to make a formal thank you to an organisation through the likes of that letter to the chief executive. We certainly don't see very many coming in, but we do get quite a lot of this. And it's nice that it's at a kind of board or individual level so that we can send it to either the specific member of staff named or, as I say, their manager. The private sector, of course, have been doing customer feedback for years. And one of the teams that I like and follow quite avidly because of that is O2. Some of you may remember that at some stage last year, O2's entire network crashed, and people then took to the social media to criticise O2 and have a go at them. And again, it was building up a head of steam. The O2, who have a squad of people doing this kind of thing, so it's not just one or two people, chose to respond in a very set way, and it started to win them a lot of favours. Here's the example. I've redacted the sweary words just so nobody's offended. But it was O2, something you, suck something in hell, fill in the blanks at your own leisure. And O2's response was, maybe later, we've got tweets to send right now. So people ended up commenting on how good the O2 Twitter feed was during the crisis. So rather than commenting on how upset they were with O2, people were retweeting the responses because they were humorous. And O2 have also got a reputation for this kind of thing. When it was a big man, well, I'm not going to try and read it out because I'll make a fool of myself, but somebody speaking to them, using the kind of, I'm going to show myself up here, but kind of urban language. And O2 responded using the same kind of language. And this is what happens, and somebody is saying, do you know what, I'm looking for a new mobile network provider, I might choose O2 based purely on their tweets. And O2 have put, that makes us smile. So again, they're responding to things that are coming in the same way in which we at NHS Lothian try to do.
As is the NHS, are ready to support their staff in treating back with this style?
I would like to think so. Certainly, what I would want to see. I don't know whether it depends who's empowered to do it, and that's all the issue within NHS, and it's still why some boards don't use Twitter or Facebook, because they don't feel they can resource it, or that they can empower people to respond without having to send a memo to the chief executive or necessary executive director to give a response. And by the time you've got that and gone back, then it's too late. Again, I feel you have to train and get people. I'm sure that O2's chief executive wasn't involved in any of this. It's just that you trust the team to go back, not say something controversial, but to say something, maybe a bit of disarming humour, to respond and to recognise. And that's all about staff training, I would say. Sainsbury's at it as well. Dear Sainsbury's, the chicken in my sandwich tastes like it was beaten to death by Hulk Hogan. Was it? And Sainsbury's have responded by saying, I'm really sorry it wasn't up to scratch. We will replace Mr. Hogan with the Ultimate Warrior on our production line immediately. So again, somebody's coming in with a bit of a humorous complaint and they respond in time. Now, if the next one works, it requires internet access, so bear with me. This was the use of Facebook for feedback, and I mentioned before that sometimes somebody can send something to an organisation and before you know it, it's been circulated around the whole world and there's literally tens of thousands of likes and comments on it. And again, reputations can be won or lost on that. A serious example was the one at Braehead, where Braehead Shopping Centre just down the road, where the chap had, I know about the background to this, I need to be careful, he'd been allegedly taking pictures of his own daughter eating an ice cream sitting in Braehead Shopping Centre. Police officers then came up to him and told him he was being cautioned under the Prevention of Terrorism Act if he didn't hand over his camera. He then took to social media to say that this was an absolute outrage, it was his own daughter, surely he can take a picture, etc, etc. And regardless of the rights or wrongs around that particular case, and there's a whole other story about it, but nevertheless, I'm being recorded, so I'll be very careful what I say. The social media fallout from what happened there was immense, and people started up a boycott Braehead page, which had within something like 20 minutes, 20,000 likes. The story was being broadcast around the world. The mainstream media, as is normal nowadays, picked up on the back of it. They weren't on the front foot, they're usually on the back foot with these things. And Braehead faced a very, very difficult decision in terms of how they would be responding to that. Strathclyde Police at the time chose to put out a very, very interesting social media message, which was, Mr. Jones knows why he was spoken to, and we won't go into any more detail than that, which was very cryptic, I thought, but and very brave, I have to say, given my knowledge of having worked at the police. But it does just show that they felt the need to respond to something where reputations of both the police and the shopping centre were being destroyed. This one, and I hope it works, was a slightly funnier one. It was a guy went onto Facebook and he put, "Hi, as a man, I must ask you why you have lied to us for all these years. As a child, I watched your advertisements with interest as to how at this wonderful time of the month that the female gets to enjoy so many things. I felt a little jealous. I mean, bike riding, roller coasters, dancing, parachuting. Why couldn't I get to enjoy this time of joy in blue water and wings? Then I got a girlfriend. I was so happy and couldn't wait for this joyous, adventurous time of the month to happen. You lied. There was no joy, no extreme sports, no blue water spilling over wings, and no rocking soundtrack. Oh no, no, no. Instead, I had to fight against every male urge I had to resist, screaming, 'Whoa, body form for you,' as my lady changed from the loving, gentle, normal skin-coloured lady to the little girl from The Exorcist with added venom and extra 360-degree headspin. Thanks for setting me up for a fall, body form, you crafty bugger." Now, obviously, a humorous piece of information was sent to Bodyform's Facebook page. This was their response, and I hope I can get it to work. Do you like the blue water?
Hello, Richard. I'm Caroline Williams, Senior from Bodyform. We read your Facebook post with interest, but also a sense of foreboding. I think it's time we came clean. We lied to you, Richard, and I want to say sorry. Sorry. What you've seen in our advertisements so far isn't a factual representation of events. You're right. The flagrant use of visualization such as skydiving, rollerblading and mountain biking, what horse riding, Richard, are actually metaphors. They're not real. I'm sorry to be the one to tell you this. There's no such thing as a happy period. The reality is, some people simply can't handle the truth. In the past, we've tried to be more honest in our approach, 1980s, we ran a series of focus groups to help us gauge the public's reaction swords, insatiable hunger. And yes, Richard, the blood coursing from our uteri like a crimson landslide. So, we knew we'd have to change our strategy. So, from that day to this, we have managed to maintain this illusion. But you, Richard, have torn down that veil and exposed this myth, thereby exposing every man to a reality we hoped they would never have to face. You did that, Richard. You. Well done. I just hope you can find it in your heart to forgive us. Sorry, Richard. You did know that we do that too.
Yes, that was Bodyform's response. I mean, they saw it as a marketing opportunity actually, because this comment to them had received literally hundreds of thousands of likes and comments. The marketing team at SmithKlaxoKline, whatever it's called, chose to respond to it, put up an actress to pretend to be the CEO of Bodyform and gave that as a response using YouTube, a video which has been seen, you probably saw there, by millions of people, and it's humorous and it shows an organisation willing to do that kind of response. That's the private sector. You asked the question, is the public sector ready for that kind of response? I think NHS Coventry did one actually about dental care, which was kind of on a similar vein. It was kind of funny and humorous. So I think that we are moving towards that, and I certainly think that people respond better to that kind of thing than the staid corporate response that you can sometimes get from organisations, particularly within the public sector. So what is the conclusion to all of this? It is here to stay. Of course it is. It's not going anywhere. It may change names. We may change the way that we do it. We may change the way that we use it. But I think that social media and the way in which people can interact on a 24-hour basis, the way in which people now expect a response immediately, and if they don't get one, that in itself becomes a complaint. That's here to stay, and we need to look at that. It's constantly evolving, and therefore we must evolve with it. The public sector are behind in terms of how it uses social media. We've heard some excellent examples of good practice today, and I think that should be the kind of template that we use to go forward, and we need to kind of catch up to where the private sector are with this kind of thing. And I would just finish by saying, you know, embrace it, don't fear it, be bold, and I think you'll get the results from using social media. If you are on Twitter, please follow at NHS Lothian. You heard today we've got the most followers out of anybody using Twitter, 4,500. And if you're interested in motorbikes, scouting, whiskey, or general nonsense, then you can follow myself at Stuart989. I'm happy to take any questions. Don't be shy. Go first.
Yeah, you mentioned that you had a rota of people.
Yes.
How does that work? How many people roughly do you have resourced?
We have 4 people who go on the rota, and basically 1 week in 4 they will be asked throughout the day and indeed at night to monitor what's being said on Twitter and Facebook, which is the 2 ones that we use principally. And if there's anything on there that they can respond to immediately, and the stock response is thank you for your compliment, or we're sorry to hear about your complaint, then they can do so. If it's something more complicated, then we would ask them to come through. Okay. We would ask them to come and contact us and speak to them in greater detail. But we run that across a rota the same way in which we do for on-call for media calls.
Stuart, I don't know if it's questions or just thoughts or thoughts for people to take
Yep,
away.
anything at all.
We have this, in the NHS we've got this fine balancing act between dealing with what's being raised and then the formality of reporting on that. X number of feedback comments, X number of complaints resolved within so many periods, or a consultation exercise, and this is where. And I guess there's something in my mind around how do we meet that formal bit of capturing quantity and quality of the comments being made, but also meeting that sort of patient rights bit around don't treat everything as a complaint, treat it as feedback, or try to resolve it earlier, and the paperwork that's normally associated with concept. So I don't know if it is a question or just one of these flag up, isn't it? Get caught up in paperwork following the simplistic approach.
It's an interesting point. I was speaking to somebody about this at the coffee break, because we have government imposed targets for complaints, 3-day response rate, 3-day acknowledgement rate, 20-day response rate, and reduction in complaints generally, none of which we are meeting at the moment, I should add. But there's nothing in there about how many compliments are you recording or how many comments are you recording. And I wondered aloud at the coffee break whether it would be helpful to have some kind of target almost set for or instruction to start collating compliments, and then we would get a bit better at it, because with like any public sector body, as soon as you're told you have to do something, then you find a way to do it, and you do start collating that information. And at the moment there's so much being lost. If somebody walks into, as I did, a special care baby unit, and you hand in a card and a thank you and all the rest of it to the staff there, unless they escalate that through their managers, that's not recorded anywhere. So what we get is, stories in the papers last week, complaints about NHS continue to rise, and they do, but nobody's saying anything about what's happening to compliments or comments within the NHS and what effect they're having in service change. And I feel that we need to be looking at the whole picture rather than just the complaint side of it. But it is interesting as to how that would work in terms of the bureaucracy around it, because there's already huge bureaucracy around the complaint side and how that has to be dealt with.
Well, we actually do gather all the compliment cards, and every 6 months I do an incident report on complaints, and the compliments are part of that complaint, so we've got balance.
Is that across the whole organisation?
It's across the whole of our CHP anyway, and
Right.
it's good for staff morale, because they see the small number of complaints, but the huge number of compliments.
Absolutely agree. John?
We struggle a lot with the question of central control versus empowerment. If you took IT restrictions aside, or information security restrictions aside, what would be your ideal? Would you have more people using the same NHS Lothian identity, or would you break it down and allow separate parallel identities to go on?
In terms of within NHS Lothian?
Yeah.
I get challenged on this almost on a daily basis, because people want their own Facebook page for something, they want their own Twitter feed for something, and I always say no, not because I'm an obtuse kind of person, but to me I feel it dilutes the brand. If you allow NHS Lothian to have 7 or 8 different Facebook pages, and then it's set up for a kind of small lifetime of a specific project like theatre nurse recruitment, which we were doing, for example, then I'm saying, well, you should be going through our main page for that. And we'll empower you and show you how to use it and allow you to use it yourself, and you can put things on and respond, so it's not just the communications team, rather than allow for me, which would be a dilution of the brand, where you've got 10 pages with 100 followers each, as opposed to driving everybody through the central one. Because the advantage of driving everybody through the central one is, of course, you can give them other messages as well that may be of interest to them. So I'm certainly a fan of keeping things under the one umbrella, as opposed to allowing all kind of different offshoots. Is there anybody here from Glasgow, incidentally? Clyde Health Board? Because Glasgow do the kind of campaign thing where they set up Respect My Dying Wish, which is the one they're doing just now, which is the organ donation. I think it's great, I'm a member of it, I interact with it, but I also think that Glasgow, and I've said this to Alex, I know Ali well, that Glasgow should be using Twitter and Facebook, and in fact I sit in a national body at the moment which is looking at emergency planning within the NHS, and one of the recommendations within that paper is that every single health board in Scotland should be using Twitter and Facebook as an absolute minimum as a corporate organisation, and that's going to pose challenges for some people who don't use that just now. But even for emergency planning purposes, which is I know is not the reason we're here today, but I feel that you should be using that, and that's the recommendation in the paper. You're very. Where you go?
I've been sitting doing this and
Sorry.
I need to put my hand up high. Just a question about, I'm not sure if you'll be able to answer it, but for me there's been loads of examples in your presentation of feedback that shows we could do better, and feedback that shows that you're doing really well in some places. So my question is, how do you use the feedback? What happens? It's the so what question. So you clearly have loads of things there that you can learn from. So how does that feedback then go into the system and drive quality improvement?
The you said we did stuff?
Yeah.
Yeah. The honest answer at the moment is that it doesn't, but it should, and we're working on making the fact that it should. But then that's the same, and I think you'll find a lot of public sector organisations that, be careful not to be controversial here, but you're so driven by the target in terms of complaints, and it is about complaints, that there's not a lot around how you're using those complaints to improve service. It's more about where you are in terms of the target of the complaint.
So So I suppose what I'm hearing then is that moderating that conversation is about protecting the organisation, but it's not necessarily about going out there to make things better for the people that use our services. Or that might be the aspiration, but we're not quite there yet.
That is the aspiration, but we're not quite there yet. You're absolutely right. To me, that's exactly what we should be using it for. We should be using complaints and compliments to inform service improvement. Absolutely.
It was just a comment, like you're saying with your confidence and that, no, the only thing you're saying is, good news isn't used at all. But also the question I was wanting to ask you, you may have answered it in one of your last comments, was how did you go over the NHS fear factor of social media?
Me personally,
or the organisation? Or when you answered the question was saying, people are wanting maybe Facebook pages, or you maybe sort of still, the fear factor still there.
yeah, and I think it's to do with personal trust. I mean, I'm trusted to look after this kind of stuff for the organisation, and they know that I'm not going to be a kind of wild card that's going to allow things to go in, that we're going to continually get phone calls from the public or politicians about things that are appearing. So I think you absolutely have to ensure that people who are running your social media are trained in the editorial side of it and not just the technical side of it, so that they can start to take that kind of private sector approach where you're responding to people as individuals and that you're just dealing with it in a way that doesn't harm the organisation. Don't know if that answered your question. You don't look convinced.
I've got a wee bit of fear in that one.
There's still a long way to go. I don't think there's any doubt about that in terms of public sector being signed up to completely going with this kind of thing. But to me, that's a journey we're on. And as I say, I remember the days where we weren't allowed to use internet because they thought everybody would spend all day booking their holidays and doing their Tesco shopping. And to me, that's a management issue, not an IT security issue. I would know if my staff were spending all day on the internet booking their holidays because they wouldn't be getting their work done. It's the same for social media. You would soon know if somebody was spending an entire day on Twitter or Facebook, particularly if it wasn't work related. Apart from anything else you could check. No more. I think we're probably up against time. Thank you very much, everybody. Thanks for coming on.